Muted.
All right, welcome. We're here to talk about the West Virginia Universal Pre-K Health and Safety Checklist. My name is Janet Bach-Hager. I'm the Pre-K Coordinator in the Office of Early Learning and a member of the steering team. I also have with me Matt Williamson. And Matt, what office are you from now?
I'm with the Office of Data Management and Analysis.
Okay. And Matt assists us with so many things. He's a pretty brilliant guy when it comes to technology and otherwise too. So, I also have Rhonda Fisher from the Office of Early Learning. She's a coordinator with us too. And I know not in the room with me, but out in the field are members of our pre-K steering team, Ginger Huffman from the Office of Special Programs, Missy Smith from the West Virginia Department of Health and Human Resources is also with us, and Tracy Dalton, the Head Start State Collaboration Director. So I just wanted to share those folks with you, and also let you know, the work that we're going to discuss today was, everyone on the steering team as well as a lot of folks from the field have helped make this possible. If you look at on your screen, you can see that it's presented by the Universal Pre-K Steering Team, and I just wanted to share with you, when you are able to access this PowerPoint, which we'll put up on the System of Support website, you can click on the link here that says the West Virginia Universal Pre-K Steering Team, and it will actually take you to our page, and I'll show you that shows the steering team and all of our contact information as well. So I just wanted to provide that information to you all up front so that if you have some follow-up questions, you can feel free to contact any of us at any time too. All right, so let's get started. So as we begin the overview of the Universal Health and Safety Pre-K Health and Safety Checklist, I just want to point out that this was designed to help county teams ensure that we have healthy and safe environments. Previously, we had health and safety checklists, and we also used the ELRS. The ELRS is being replaced with the ELRS 3, and the model that we had in West Virginia can no longer be a process that we implement with the ELRS 3. We had a process that folks could be deemed reliable in the state of West Virginia to be an observer utilizing the ELRS, and with those changes, the authors of the ELRS have, they've changed some of their processes for becoming a reliable rater. Therefore, what we used to use the ELRS for to establish healthy and safe environments, we don't feel like we can continue to use that in a way that would be cost effective throughout the state of West Virginia. In addition to that, the health and safety checklist meets additional requirements. The health and safety screener from Head Start, which is required in every classroom that offers Head Start services, and that's many of our classrooms in the state of West Virginia. In fact, 61% of our classrooms are in collaboration with Head Start. So they have a health and safety screener that has to be completed, and this new health and safety checklist encompasses all of the pieces of the health and safety screener. It also encompasses Policy 2525 requirements, which capture child care center licensing regulations. So what we've done is a comprehensive stakeholders group came together over several months. In fact, we began back, I think, in January with this process and have spent many months on it, developing one health and safety checklist for all pre-Ks in the state of West Virginia that will meet all of those needs. The last piece that we will send out once once we finish this webinar, is a side-by-side comparison or crosswalk of the Head Start Health and Safety Screener along, with our health and safety checklist, so that anyone with any questions about the health and safety screener for Head Start purposes can utilize the crosswalk to ensure that all of the requirements are being met. Okay, I think I'm having some sound issues. I hope that they're better. So bear with me just for a second. All right, I hope we have better sound now. Somebody let me know in the chat box if there are any sound issues. So one of the main things that we want to point out right off is that the West Virginia Universal Pre-K Health and Safety Checklist will need to be completed within the first 45 calendar days of each school year. So beginning with this year, this will replace the ELRS, and it will have to be done within the first 45 calendar days. So what does that mean for the ELRS? Anyone who would like to use the ELRS for this year can continue through this year. Any county that would like to use that can also utilize the ELRS database to enter information and get the report for this year. I know that the early learning rating scale folks out of Chapel Hill will be phasing in the ELRS 3 and have begun training for those folks. So if folks want to use the ELRS 3 or the ELRS R, they should feel free to do that as part of their continuous quality improvement process. However, this will be required. Those are not required. So that's the big change. This has also been replaced in Policy 2525. So in Policy 2525, it will now reflect the health and safety checklist rather than the ELRS R. In fact, it's up for public comment right now, Policy 2525 revisions. The major revisions of that were the health and safety checklist and the dental requirements for enrollment this year. So those are the two big things in the policy changes that you can see. But like we said before, it's required in 61% of our Head Start classrooms as part of their grant. So it's important that we implement this process now. So where do we go from here? What we want to kind of do is just give you the overview of the instructions for use. These instructions are also captured on the front page of the health and safety checklist. If you notice up in the corner, I sent out over the listserv a copy of the health and safety checklist and a copy of the health and safety checklist corrective action plan, and we'll talk about those items as we go through. But if any of you noticed, up in the corner it said draft for pending graphics. It will actually look just a little cleaner once it goes through our graphics process, but we wanted to get it out to you. And it's basically going to be the paper copy that we sent out, or the electronic copy that you can print and produce a paper copy of, is just that. It's just a worksheet, and we'll talk about submission and generating reports in just a few minutes also. So right now, County Collaborative Early Childhood Core Teams should be determining who's going to make up these observation teams and the schedule for completion of the health and safety checklist in each classroom. Each observation must have a minimum of 2 observers, and observers cannot be classroom staff. We encourage teachers to utilize the health and safety checklist throughout the year to kind of as a tool for checks and balances, but for the official health and safety checklist that needs to be done within the first 45 days, it should be someone other than the classroom teachers. And this was something that the stakeholders group really had discussion about, simply because, you know, teachers oftentimes when they live in their classrooms, when assistant teachers live in their classrooms, sometimes you don't always, you know, see those things. And having a fresh set of eyes is very helpful in ensuring the health and safety of young children. So it should be someone who is not in the classroom. It can be an administrator. It can be an outside someone from the collaborative team or someone from the building, just not someone from the classroom. Each observation team will conduct the assigned observations and complete the health and safety checklist as scheduled. You can use the paper or electronic version of the Universal Pre-K Health and Safety Checklist during the observation. All the results from each health and safety checklist will have to be input into the ELRS, but you don't have to take a computer into the classroom. You can use a paper copy and then transfer the information if you'd like. And we're going to talk about the early learning reporting system and inputting it in there, and I'll show that to you in just a few minutes as well. So one of the members of the observation team has to enter the results of the health and safety checklist onto the ELRS. So at least one of the team members has to have access to the ELRS pre-K. So that's very important when you're doing the scheduling to think about. One of those folks has to have access to the ELRS in your county. And as we're also doing registrations right now, pre-K coordinators, itinerant teachers, teachers and assistant teachers are all registering on the ELRS system. And then as of September 1st, everyone else in the pre-K system will be able to register also. So if you do health and safety checklists and the person on your team is not registered until September 1st, they can just enter the information. They could use the paper version and enter the information after they're registered. But the actual completion of the health and safety checklist needs to be done within the first 45 days of school. Okay, so the health and safety checklist, while we're not going to talk about each of the indicators, I'm going to talk about the process for completing it. There are 5 major sections. We have the environmental checklist for indoor, the environmental checklist for outdoors, supervision, health and safety procedures, and transportation. If you do not offer transportation in your county, you will not have to do that section. But most people have transportation in some capacity. So for each, there are a series of items for each of the areas, and basically we've tried to make this as simplistic as possible. You go through each of the items and go through the environment, and when we talk about the environment, it's the whole environment for the child. If the preschool children are in the cafeteria, you have to look at the cafeteria, you have to look at the outdoor space as indicated as one of the areas to look at. So you have to look at the environments that the children actually have access to. And you mark yes or no in the space provided in each answer to answer each question. And then if the answer is no, you must include a comment on the checklist. and there are quite a few questions. We tried to keep it as clean as possible and still meet all state and federal requirements. But if there's something that you know within your policies and processes, if there's something that doesn't match up, which there are very, very few items that do not match up with your policies, then you need to note that in the comments. So if you have a question as you're going through the health and safety checklist, if you have a question about specific indicators, email one of the steering team members. We're happy to answer any questions about each of the indicators. Like I said, the steering or the stakeholders group that went through this, they took all of those policies and procedures and lined them up and actually created what the steering team really was impressed by the work that this stakeholders group did. And there were a variety of folks who participated in it. There were Head Start directors, program specialists from Head Start, there were pre-K coordinators, there were teachers, there were social workers, child care directors, and child care employees. And we had a really good group of folks who really knew their standards and brought a lot to the table, and we really appreciate their work in making this the most efficient process that they could. But nonetheless, there may be one or two items that some of you will look at and say, I don't think I'm required to do this. Then on your team, if you can't determine from your team, feel free to give us a call and we will follow up with you and make sure that you can make the most appropriate comment in the comment box. If there's something that could cause immediate danger, we expect that the team will address anything like that immediately with the classroom administrator and/or the teacher prior to exiting the building. If the administrator is not available, at least addressing it with the teacher and noting exactly what you did to address it on the form, and then on the online platform to address any immediate issues that you might see while you're doing the observation. Well, we ask that you do not leave the building until you address something immediate with one of those two folks. The next step is to enter the results on the ELRS pre-K. I'm going to show you. There's a link on here for it, and I will pull it up. And I'll log in so you can see. Now I have some tabs, right, Matt, that other folks don't have right now.
Right.
And you won't have this. It will be actually available next Friday. But what you'll do is go in, and the observation tab will be available. You'll hit create, and you'll notice on the form the counties are all listed, and all the county information has been uploaded into the system. And so when you go into the county, the sites will show up. If there's more than one classroom, it'll pull up the classrooms, but the principal's already listed for the school. And as folks get registered, this will also change. As you can see on the screen, I'm using Barber County and Philippi Head Start. The administrator can't register until September 1st, so their name is not listed yet. So those folks, as they register, it will automatically generate those things. The teacher will, once the teacher for this classroom is registered and assigned to this classroom, then that will show up as well. And then once all this information is included, you click the Save button. I do want to note, like on the date, the format is in gray. That's just the guidance for how you should enter the date. And then for the observers, you can add observers to the list too. And then you click Save, and then you begin to complete the health and safety checklist. If it's yes, you can just press yes. If it's no, the comment box pops down. Like we said earlier, if you answer no to any of the items, you must include a comment. There's only a couple, maybe one or two instances, and I'll take you down through it, where you might answer yes and still make a comment. One example is under the health and safety procedures, where you have to answer about required license and inspection certificates are current and posted in relevant areas. The other is, it says other, please list. You would press yes, and then you can check comment and then enter the comment to list the other. So it's very clean, very simple process. And then with each section that you complete, you can click the Save button, and then the last part of the process, which is being finalized right now, will be to, once you've reviewed all of your comments and all of your processes, you can finalize the report. And this kind of takes us to some variations between the process or the form that you all received through email today and what's online. So I'm going to talk about that for a few minutes. So when you go online and you're entering the information, you will place, there'll be a question at the end of the checklist that asks, for you to place a check mark in the box titled immediate follow-up requirement action if there were items that required immediate attention. So if you did find something that was an immediate health and safety need and you addressed it with the staff and the administrators, then you'll note in the online process exactly what happened there. And then it'll have a place for notes. Now, when you look on the screen here, it has, the lines for you to include notes. That's what the form looks like, that the paper version that you have. But when on the screen, you'll have a text box to enter that information into. And then another question, the last question on the whole process was place a check mark in the box in the section titled Corrective Action Plan if a corrective action plan is necessary. So maybe you don't have something that's an immediate health and safety concern, but let's say, the fall zone on the playground, you need, it's dug down and you're recommending mulch for the playground, then you would include that as a corrective action plan. But the corrective action plan is not included in the online submission. It is something that you will follow up with later. So the last step, once you've finalized your report, is to print a copy of the report to share with classroom administrators and staff. And we recommend that this is done within 10 days of the completion of the health and safety checklist, so that some of the things can be addressed as quickly as possible. And not only that, it's very respectful to administrators and classroom staff. If you come into the classroom and you've done an observation, to give them a summary of what you saw, so that they know what they're doing well and what they might need to fix to ensure health and safety. So once you've hit finalize and you generate the report, you'll get what's a PDF. It'll be a PDF version of the report, and this will be different from the report that was sent out, because it will have one section that is not included on the paper copy that you use as a worksheet in the classrooms. It will have a a section for debriefing participants so that you can list and have those folks sign who participated in the debriefing. And we'll talk about that in just a minute. But again, we recommend that that happen within 10 days of the observation. So each debriefing meeting participant should sign the health and safety checklist under debriefing meeting participants. And this is sort of what it looks like. It will have a list of those, and then if there are anyone additional, you can add more folks to the bottom. But this was just, oops, this is basically the main difference between the printed copy that you'll have access to and the online version. When you hit finalize, you'll be able to access the PDF version of your report to print for hard copy, and that's the only one that will have space for signatures. So the worksheet you won't have. This PDF is the one that that you utilize for your debriefing. So when you do the debriefing, you can the next step is if you have any things that need corrective action plan, you can decide and actually generate a corrective action plan for any of those items. And we provided I emailed a Word document that had those because you can actually use this if you would like, or you can create your own. We'll include this as a tool in the CQI process, but I also wanted to get it out for you all to utilize as you begin the health and safety checklist process. Basically, what you can do is, take these with you to the debriefing meeting, and then add, you can generate your corrective action plans as you want. And as you go through, I'm going to pull the actual form over now. You actually go through and enter the information in each of the boxes. As you go, once you complete this information, then you'll include what you want to happen, what outcome you want from this corrective action, and then include the section and the item that you're addressing in this corrective action, and then what steps you need to accomplish the outcome. So if you have, and this is why we provided it in Word, so if you have 3 action steps, you can actually expand the boxes to capture more action steps by using the Word version of this form. So this was sent out along with the health and safety checklist this morning. All right, so that basically takes us through all of the nuts and bolts of it. I'm just going to ask if you all have some preliminary questions as we get started with this process. I know that it's it's a lot to digest on a Friday afternoon anyways. We had one question from Karen Browning, but I think I may have answered it also. She asked, is there a print option if we complete the checklist online and then want to print hard copies later? Actually, everyone's required to enter the data online, and then you can generate a PDF copy of that once it's finalized, of each report once it's finalized. I want to, while we're waiting for some questions that you may have as a team, I want to thank all of the stakeholders who participated in this lengthy process, because the folks that came to the table, they worked so hard. I mean, they were long meetings that really put pencil to paper for a whole for a whole day with hardly any breaks. So, you know, those folks that that were a part of this, we will acknowledge them in the revised continuous quality improvement process guidance document, which we'll discuss at Leadership Institute. And this whole process will be included in the new CQI process, and we'll acknowledge all of those folks too. We have a question. Are principals allowed to be one of the observers in their own schools? They absolutely are allowed to be an observer. In fact, I would want to be a part of the team if I were a principal or a Head Start supervisor. You could use a variety of members for teams to do this. It can be health coordinators along with pre-K coordinators. You can program support folks who do this regularly in Head Start programs. Child care directors can do those in their classrooms with other folks too. But not in their own school, right? Yeah, they can do it in their own school. Right. Yeah, Rhonda asked if they could do it in their own school, as long as they're not the classroom teacher or assistant teacher. Then we had another question. Will Head Start still have an additional checklist they need to complete, or will this satisfy their requirements? We designed this health and safety checklist with the health and safety screener from Head Start, so it can actually be used in lieu of the Head Start health and safety screener. All of the questions are encompassed from that screener in this health and safety checklist. Like I said, we will have to you by next week the crosswalk that goes along with it too. So we have a crosswalk that matches up all the questions from the health and safety screener to all the questions on the health and safety checklist, so that we are satisfying those federal requirements. So it can replace it, yes. We have a question, can you attach a pictures to the report? Who do you contact to become an observer? The County Collaborative Team determines the observation teams. So the core team determines who's going to do observations in each classroom. Tracy wanted me to mention that the questions related directly to early Head Start were not captured in the in the pre-K health and safety checklist. We excluded the early Head Start questions because they absolutely were not applicable. And any early Head Start grantees will have to utilize the Head Start health and safety screener in the early Head Start classrooms. Michelle Martin said that she enjoyed working with us on the checklist. It was hard work. I'm really, really proud of that team. Once the health and safety checklists are entered, we will develop a process to aggregate the reports to generate some county-wide reports to look for health and safety trends. When that's built, we'll disseminate information to let you all know how to access those reports too. We've worked for Matt Williamson to death, and we're happy every day when he shows back up to work. He really is dedicated to this. So Lori Woods asked, how long do you estimate it to take to complete an observation? Well, you're going to be looking at the indoor environment. You're going to be looking at the outdoor environment. You're also going to be looking at, policies and procedures and asking some questions. So, it's going to vary. The first time it's going to take you, substantially longer. I don't really want to put a time estimate on it, but it shouldn't probably take more than maybe, with transportation, it could take maybe 2 to 2.5 hours to really look at each of the pieces. Oh, we have a question. As a new director, how do I receive access to the ELRS? If you did not receive an email on how to register, email me and ask for that, and I'll send it. It went over the listserv probably 3 weeks ago, 2 weeks ago. And basically you go onto the ELRS site and request and complete the registration process. Actually, I can pull it up.
You have to log out.
Yeah, I'm going to. So I'm going to log out. And then to register, you would go to the registration tab and click District Coordinator, and then you complete this online form and apply for an account. Karen Browning said, this is great. I think it will be an asset for federal Head Start review teams to use. That's why we felt that the crosswalk that we'll send out next week is so very important, because we know that when federal review teams come to do the health and safety protocol, they're going to ask, have you done the health and safety screener? And we really wanted to capture, we wanted to make sure that we provided every county with the tools to assertively answer those questions for the federal reviewers. And then there was a question, did you say you emailed the form to us today? We emailed the health and safety checklist, and it's a PDF form, and we also emailed the health and safety checklist corrective action plan, and that's a Word document that you can edit, because that's a tool that you can use for completing corrective action. And they were emailed through the listserv. A pre-K coordinator, Michelle asked, I've applied as a user and still pending. How long until I receive permission? You should have an email.
There should be an email confirmation that you received. You have to click the link inside of that email. And what that does, that confirms to us that we know that you have a valid email address. And once you click that link, it comes to us. Otherwise, it'll just stay pending forever. And it looks like she got it. Okay.
All right. Okay. Lori, if you did not receive something on the listserv, email me and I will double check and make sure your name is on there and your correct email is on there, and I'll resend the forms to you.
If you need to go to the website, we have a short URL for the reporting system. It's wvde.us/ELRS, and that'll get you there. .us/ELRS. That takes you straight there.
Oh. Okay, there's a question, is there a difference between collaborative classrooms and non-collaborative classrooms in the ELRS?
Not with requirements.
I'm not sure the context of that question. The only difference is we somewhat separate the collaborative classroom teachers from the non-collaborative classroom teachers. And help me out here.
For the purpose of 3-year-old non-collaborative,
right.
All pre-K classrooms are pre-K classrooms, so those we do not differentiate. The difference in what we call non-collaborative in the system, in the ELRS, is if you're a 3-year-old Head Start classroom, because those classrooms still have access to the child assessment system, and they, those 3-year-old classrooms are separate because they don't fall under the state aid formula. They don't fall under the definition of West Virginia Universal Pre-K and are not in contract. But all pre-K classrooms are all pre-K classrooms, whether they're collaborative or they are not collaborative. So I know that's tricky, but so for the purpose, you have to ask the question, is it a 3-year-old classroom or is it a pre-K classroom that doesn't have a collaboration? If it's a 4-year-old classroom that doesn't have a collaboration, it does not differ from other collaborative pre-K classrooms. All right, so we're gonna wind up for this afternoon. I know that many of you are really kicking off the school year already. It's kind of hard to believe, but so we'll end for today. If you think of any questions, and we know that you'll have questions along the way. Anytime we roll out something that changes the process, we know that we really do need to allow time and effort for refining. So we will absolutely do that, and we really appreciate you taking time this afternoon. For those colleagues who couldn't be on here, we are recording this and posting it on our website. You can get to it by going to Universal Pre-K on our Office of Early Learning site, and then Pre-K Leadership System of Support, and we post our webinars down on the resources page or section of this page. So we'll end, and everyone have a good weekend and stay safe.